Hi everyone, welcome to my channel. In this video, I am going to explain what is CRP test and what are the functions of CRP and in what conditions CRP levels will be increased and symptoms of high CRP, procedure involved in CRP test, cost of CRP test and in what diseases CRP levels will be high. Before that, if you have not subscribed our channel, please subscribe and encourage us to make more such videos. So, what is CRP? CRP is nothing but C-reactive protein. Whenever there is infection in our body, our immune system releases some inflammatory mediators like CRP. This C-reactive protein is released from the liver by the hepatic cells. Coming to the functions of CRP, CRP has many functions like anti-infective properties. It removes the infection by phagocytosis and it has anti-inflammatory properties, and CRP also has scavenging action. It removes the dead cells in our body. These are all about the functions of CRP. Coming to the normal CRP levels, normally CRP levels ranges from 0.8 milligrams per liter to 3 milligrams per liter. Causes of high CRP. Normally in pregnancy and people who are using oral contraceptives and females have high CRP levels. And in infections like bacterial infections and viral infections, CRP levels will be high. And in autoimmune disorders like rheumatoid arthritis, systemic lupus erythematosus, CRP levels will be increased. And in conditions like tuberculosis also, CRP levels will be raised. And in heart problems like cardiovascular diseases like myocardial infarction, CRP levels will be raised. And in traumatic conditions like burns and fractures and in cancers like lymphoma, CRP levels will be raised. And CRP levels, high CRP levels we also seen in transplantation cases like kidney transplantation, etc. Coming to the symptoms of high CRP levels, CRP is a non-specific test, but we'll see some symptoms based upon the area which has been infected. For example, if you have any bacterial and viral infection, you occasionally see symptoms like fever. If you have any respiratory problem, symptoms like cough, breathlessness will be seen. And if you have rheumatoid arthritis, etc., you have symptoms like joint pains, etc. Coming to the procedure of CRP test, for the CRP test, there's no preparation is needed. You can have CRP test at any point of time. A blood sample is collected from the patient and is sent to the lab for examining the CRP levels. And the results will be come on the same day. And the cost of CRP test ranges from 200 rupees to 500 rupees. And the cost varies from region to region and laboratory to laboratory. Coming to the diseases which causes high CRP levels. Some diseases act as risk indicators. CRP levels act as a risk indicator like in heart conditions, stroke and obesity. High CRP levels indicates the risk of occurring the disease more likely. Like if CRP levels are less than 1 milligrams per liter, the person is low risk of developing cardiac problem. If CRP levels are 1 to 3 milligrams per liter, the person is medium risk of having cardiac problem in future. If CRP levels are greater than 3 milligrams per liter, the person is high risk of developing heart problem. This is all about the CRP test. If you like the video, please share and subscribe. Thank you.